All right, so we are officially recording. So I'd like to introduce everyone to Dr. Deborah Reed. She's affiliated with UK, and she's going to be presenting today on stress, depression, suicide, and suicide on the farm. So at this point, I'm going to pull up the PowerPoint and turn it over to you, Dr. Reed.
Okay, thank you, Catherine. So I don't know how many of you all are from a farm or a rural background, but hopefully some of you are. But stress, depression, and suicide is actually at epidemic proportions across the U.S. with farmers, and more with primary farmers than with the farm workforce. So I am Kentucky's agricultural health nurse hired through the UK College of Agriculture, Food, and Environment, and I'm happy to present to my fellow nurses or any other represented health disciplines here. I am an occupational health nurse, and my specialty is agriculture. Next. So the objectives today, and we're going to run through these slides very rapidly, is I'm just going to talk to you about the leading stressors in agriculture, both physical and mental stressors, and then provide some simple tools or way to help you in your evaluations, referrals, and interventions. Next slide. So when we're talking about stress, you know, there's all kinds of stress. We all have it, because if you don't have it, you're dead. So that's a bad option. But what we're really talking about today is distress, and that's stress to the extreme, where it's kind of a state of danger or desperate need. It can cause you a great deal of physical or mental suffering. It can be pain. It can be just anxiety, things like that, when we know that the world is full of that today. Then there's this flip side of it called eustress, from the Latin eu, meaning sweet, or sweet stress. And that's the kind that makes you energized and feel much better. But what we really need to do with everyone, including all students, is to de-stress, and that's to relax your body or mind, to help you kind of stop those feelings of distress that you have. And we all know Americans go kind of fad crazy every once in a while. So right now it's mindfulness and yoga and centering and things like that. Next slide. So how can stress be good? Well, it's not always a bad thing. We just have to make sure that we don't have too much of a good thing, right? So eustress motivates us, focuses our energy. It helps with that fight or flight mechanism that we have. So a short period of stress makes you feel like you can just outrun anything. For our farmers, sometimes they think they can outrun a bull. That's really not a good outcome there, but it feels exciting. It can actually improve your performance. When this carries on for a long period of time, though, that's when it becomes distress, because our bodies are only made to produce so much adrenaline or so many endorphins, and then after that they become kind of toxic and they turn on us. So that's when it leads to mental and physical problems. Next slide. So this is my sister's farm. Doesn't it look beautiful? It is beautiful, actually. It looks like a place where nothing bad could ever happen, right? Just nice and relaxing. So get that picture in your mind as we go to the next slide. And I'm going to talk to you about what happens on that farm. My sister is 85 years old now, and farming is the most rapidly aging workforce in the U.S. It's also one of the few industries that are totally family-oriented. As a matter of fact, 96% of all U.S. farms are owned and operated by families. So we have an older workforce. We have families working together. They don't really have OSHA guidelines to follow like we do in our workplaces, so they're pretty much self-regulated. And they don't have any pensions like we might have. But in Kentucky, agriculture is a $5 billion industry, so it truly is, for our state's bottom line, worth looking into. Next slide, please. So what's so good about a farm? Why do people want to live there? Well, you have a lot of shared and individual responsibility, which helps you develop actually a really good character at a young age. And then you can have shared and individual income. I've known teenagers in farming that have made as much as $66,000 a year. And I'm like, wow, that's a lot of money for a teenager to have. But they've learned how to work. We also have some cleaner air, and we have more of a community atmosphere, although that's eroding now in rural areas. Next slide. Well, what makes a farm so dangerous? We've all heard of ATV injuries. We've also heard of augers. You might want to flip that slide one more time there, because I think there's some more. Always surrounded by work, hazardous duty, people that begin working at a young age with inexperience, or maybe too long and they're not able to do that anymore. Also, rural access to EMS is very limited still, and you're working around large animals a lot of times. Where you work is also where you recreate. Lots of things make it dangerous. Next slide. Oh yeah, that machinery and equipment, we left that one out. But so agriculture is a really hazardous industry, and farmers are at a real high risk for fatal and non-fatal injuries, hearing loss, lung diseases, and the ones that are in bold here on this slide are also directly related to depression and stress issues. So we'll talk more about that as we go on. Next slide. And I referred that farming is done as a family enterprise, so even at a very young age, children are exposed on the farm to all aspects of the work, and they begin work sometimes as young as 3 years old. So it's a good place to grow up, but there are a lot of problems, and we don't ever want to forget the children. We'll talk a little bit more about that later on too, because all ages in the family farm are subject to this stress and depression issue. Next slide. We did a very large study with farmers age 50 and over in Kentucky and South Carolina a few years ago. And I wanted to run this by you because I know you're all health providers of some type, but just look as aging increases on the farm, and remember the average age is 58 years old now for the farmer, but how many problems they have with arthritis, high blood pressure, back problems, hearing problems, vision problems, and the list goes on. So we'll go to the next slide. And to just say that we did a little more advanced work with them. We were interested in the injury rates and their relation to chronic health conditions that these farmers had. And indeed, we had an increased injury rate if the farmer had hearing loss or vision problems, if the farmer had had a heart attack or currently had hypertension. Next slide. But what we also found out in that same study is that people who reside on farms, and this study was done with farm couples, so we have an equal number of male and females in this 1,500 number sample, but primarily they define health as the ability to work. It is not the absence of disease or not having to take medications or other common definitions of health that we hear, but their health is related to their ability to get out there and perform their farm work. And this is even higher among the oldest farmers that we interviewed. So people like to be contributors to society, and farmers see this as being able to do their farm work. Next slide, please. So as we're doing our physical assessments, regardless of the health profession that you're in, we need to look at several things with farmers. As farmers age, their reaction time begins to slow, and this could preclude them to injuries or other things. They can't get out of the way of a gate that's closing or a cow that's charging. We need to always look at respiratory function, balance, mental processing. And I've already alluded to the vision and hearing problems that are also interfaced with stress and depression. But there's one more thing. If you do one more click for me on that slide, we need to assess everyone for their mental health. And I know we're really pushing this for non-farm populations because we are in such a crisis here in America with substance abuse and other things that really factor into our mental health. But every single farm client that you have deserves and needs a mini mental health exam. And we'll talk about how detailed you need to be on that as we go along. Next slide. So the best strategy that you have, and this was a strategy given to me long ago when I decided to become a nurse, and I won't tell you how many decades ago that was, but it was a physician who gave me this advice. And he said, if you listen long enough, the patient will tell you what is wrong. They will not use medical terms, but you'll get enough of a clue that you don't have to run 1,000 different tests to point you in the right direction. That was good advice then, and it's still good advice now. I can hear the groan from the crowd saying, we don't have time to listen. I understand everyone is overbooked at every single aspect of their life, but unless you listen first, you will go down the wrong trail. So you have to listen to your clients' life experiences, to how they describe their typical day, to their aches and pains, but also to their mood and their hope. And we know that a person who is in such despair and has no hope is the most likely candidate for suicide. So the antidote to suicide is hope. And the only way you're going to get to that is to listen to them. Next slide, please. So I think you have to find out, first of all, who's on a farm. About 50% of our farmers in America have an off-farm job. And with this off-farm job, when you ask them their occupation, they will say things like, I'm an insurance salesman, or I'm a teacher, or I drive a school bus, or I'm an attorney, or maybe even I'm a physician. So they won't tell you about their farm exposure. So it's necessary for you to ask, are you ever on a farm? And if they say, well, yeah, once a year I go back home and I'm on a farm, well, in that case, they probably don't have a lot of exposure to farm work. But if they're on a farm, just ask them, well, what type of farm work do you do? You're going to learn a lot about what they describe to you in that. Then we have some other things that we found out from our other study that I'm just going to throw in here because you need to know it. Most farmers don't know when they had their last tetanus immunization unless they've had an injury in the last 5 years. So you need to find out about these routine things. Only 14% of farmers actually even got a flu vaccine last year. So we've got a lot of work to do on all fronts. But again, these other things that you can ask about farm exposure will help you. But the basic one you need to ask concerning stress and depression is, how do you feel about your future? Because if they come back and say, I'm not even sure I have one, all the bells should go off in your head. At that point in time, you are ethically and morally responsible to react and respond appropriately to the answer to that question. Next slide. So why is farming so stressful? We talked about this early on with some of the things that farmers are exposed to for risk, but you have to understand what's happening out there in agriculture these days. Life on the farm is not what it used to be. There's a lot of biotechnology out there, and the public doesn't like GMOs. You've heard of that. Without GMOs, we are not going to be able to feed the world, but there's a lot of kickback to that. There's a huge learning curve in farming every single day now, because a lot of the mechanization, the equipment that's used on the farm is all computer driven. It's not pulley belts and a throttle like it used to be. So every farmer of every age has to keep up. So it's just like in our professions where we have to every day learn something new. So do the farmers. But they don't have group sessions where everybody's taught at once. They learn one-on-one. When they buy a new combine, that's when they learn about the new combine. And also farmers have to keep up with global markets, and not just the global markets for agricultural products, but what's going on in government. So right now we have the whole tariff thing with Mexico, with China, with Canada, and it's really doing a number on all of our farm markets. They don't know from day to day if they can even sell their products, let alone how much they're going to bring. So they have a lot of issues. So they still have a lot of hard physical labor, depending on the type of farming they're doing, and they have long days throughout certain seasons. This year we had all that rain in the spring again, which put planting behind. Some people have had to plant 3 times this year, and some people planted and it got washed away and they won't have an income this year. Because farming you don't get paid every week or every 2 weeks. You get paid once or twice a year, depending on when you sell your commodities like your livestock or your crops. So no wonder they have one of the highest suicide rates of any occupation. And even the farmers don't know this. So it's pretty scary when they don't know that the suicide is at epidemic proportions among themselves. Next slide, please. Just to give an example of this, and this slide is very dated, it's 11 years ago this was published, but I'll bet you we could put it up for 2018 and it would look just the same. So this was a study done by some of my colleagues here at UK when they reviewed death certificates from 3 different southern states, Kentucky and North Carolina and South Carolina, I think. Now this is all white male population because most farmers in the South are white farmers and most of them are male. So we're hoping to get some updated stats on other groups, but right now this is the best we have. And if you'll notice on the left side of that, age 25 to 34, that little dotted line are farmer deaths. So it's an elevated risk at those young ages as they begin to enter into farming because they're insecure. They have to take on a lot of debt when they start farming. And then by the time you get to like 45 to 55 age group there in the middle, it's about the same as the total population, white male population in those 3 states. These are what I call the people who are successful farmers. They realize they're doing all right. The ones that couldn't have already gotten out of farming. So we have that group in there that's somewhat safe from suicide at that age. But then you notice on the right-hand side how it just astronomically, exponentially goes up. In epidemiology, we call this the epidemic curve, or a J-hook. And at the oldest age, the older they get, the more likely farmers are to commit suicide. They're very good at it. Most male farmers will make one attempt and they are successful because usually it's by a gun. So it's very alarming to me to see this. So again, the older group at highest risk. Next slide, please. And here's some of the reasons they tell me. They say farming's not like it used to be. We used to provide each other social support. Now it's a dog-eat-dog world. Ooh, that sounds like our world, doesn't it? They don't swap labor anymore. Everybody's too busy. Everybody's willing to sue. And then another farmer said, it's not a clean game. You don't meet at country stores to talk. You don't share your business for fear of someone taking your farm away, especially rental land. So the whole community social support network has eroded. They feel alone and they feel persecuted. Next slide. So sometimes for a farmer, it's just a balancing act on how do you balance hope and fear. And I'm hoping that I can hear little chuckles out there. This is not a U.S. slide, by the way. There is a disclaimer here because there's all sorts of things wrong here, including using one spouse as the balancing act for you. Although spousal support is very important when it comes to helping you with any stress, depression, and certainly with preventing suicide. It's probably not the best way to balance your tractor as you go down the road. I thought we needed a little levity here, so that's why I included this slide on this topic. Next slide, please. And I said not to forget the children. Children are so important. Children, I was raised on a farm. I wouldn't, that's me up in the upper right-hand corner. And I don't look like that now, but yeah, that's me. So there's over 1 million youth that are still on farms. And about 250,000 are hired farm workers. So that sense of responsibility that we talked about, being outside, it's good for them. But the bad things are they're at increased risk for everything because they are in the workplace. And because they are in the workplace and they live in that household, they're going to hear things. They're going to pick up on things that mom and dad are talking about. They're going to understand if mom and dad are under stress. The saddest story I ever heard was from a colleague of mine who worked at the Children's Hospital here at UK. And there was a teenage girl who came in anorexic to the point of death. And when they finally got her to give her story about why she had quit eating, she said she went downstairs one night and she saw her mom and dad opened the farm books and they were crying. And she said, I figured if they had one less mouth to feed, they'd be able to keep the farm. See, sometimes depression and suicide is very insidious. She didn't take pills. She didn't look for a gun, but she was starving herself to death to help her mom and dad. And this attachment to farmland is so crucial to the farm culture. They will do anything to keep the land, even the children. Next slide, please. So even though depression and suicide peaks at the oldest age, I want you to remember the children because nobody is asking the farm children how they're feeling. And I'm so concerned about them. So if you're in a pediatric practice, you need to be asking these kids, how are you feeling? Are you happy? Are you joyful? Or you can pick up on signs, and there's lots of little tools you can use. Just remember, though, that males are always at higher risk for suicide than females. This is true in Kentucky, where our last 100 suicide deaths of farmers in Kentucky, all but 2 have been males. Similar reports out of Georgia. But females are at a higher risk for depression. And this is through screening, and it's also by medications that are prescribed for females. Females are more open and forthcoming about admitting to depression than are the males. The males will come into your office and they'll complain of feeling tired or a backache or something vague. You have to really drill down and listen to get the males to open up when you can understand that, hey, actually they're depressed. Next slide, please. So why do they do this to themselves? Why do people farm? It's like my 77-year-old brother tells me. He still runs a beef cattle operation, mama cows and calves. He can't physically do the labor anymore, but he says, just like all the farmers I've ever talked to, I can't imagine not farming. I'd rather die than not farm. And some of them have actually said to me, I'll die on my tractor before I'll sit on my porch. So we have a lot of tractor overturns in Kentucky. I've always wondered how many of those are hidden suicides. Next slide, please. So we talked about this mental aspect, but remember our bodies work together. And I talked before about the things that increase stress and ultimately then would increase depression if we don't get stress relief. Our hearing loss, fatigue, any type of cardiovascular disease, and even dehydration. Dehydration increases your stress. Now, we're recording this in July, and we just came through this horrible heat. And, you know, so during the summer months, there's a lot of farmers that are outside, and they're really getting dehydrated. Plus the other factors, you can see if you add 1 and 1 here, you're going to get 5. So a lot of things go on at the same time with them. Next slide, please. So we wanted to get a little look some time ago, a couple of years ago now, and we did focus groups with people who were either farmers or they served farm populations. Most of them were in the service industries, things like farm credit, the clergy, extension agents, people like that. And we wanted to get a handle on what they thought was going on in their communities. We had 34 participants. I think we had 3 focus groups, and they came from all across America. So it's a pretty varied view, but some common themes came out. So from that, they actually agreed that we need some kind of systematic approach to identify these stress factors and develop farmer-friendly interventions. We're trying to do that now. We're also trying to equip professionals like you folks with evidence-based programs and resources so that you can have those tools to help the farmers that you serve. Next slide, please. So in that sample, we had primarily females, but 7 males participated, and they had a mean of almost 15 years in their current job with farmers. So they'd heard a lot of stories over that time, and 9 of them they farmed themselves. 15 of those 34 knew a farmer who had either attempted or completed suicide. That just rocked my world. I did not think it would be that high, but indeed it was. So next slide, please. So what they also told us, here's how farmers feel today. They feel beaten down. You understand when nature doesn't cooperate or when the government takes a whack at you. But, you know, now it's the public. Public used to support farmers somewhat, although even the term farmer has been derogatory in some circles in our nation for a long time. So they just feel like nobody's on their side. We talked a little bit about how they felt their community was disintegrating, they can't trust anyone, and they feel like they just can't do anything right. Well, that makes me sad just to see this. I'm getting kind of stressed here. So let's go to the next slide. But here's the other thing that happens in rural communities, and I don't know if it's a denial or stigma, but here's a quote we had from one of our participants. If a heart attack kills the farmers get cardiovascular disease screening. But when a suicide occurs to a farmer, the other farmers don't go out and seek a mental screening. They're tight-lipped. They won't talk about this. So they feel isolated. They don't realize that a lot of their fellow farmers are feeling the same way. They feel defeated. Next slide. So from our focus group, we came up with these themes that society has changing expectations of agriculture. It's a hard expectation to meet anymore. And the farm community itself is increasingly isolated and insular. They're not just doing their work by themselves. They have no community now. They work a lot intergenerationally, and that in itself increases stress. If you've ever tried to work with your parents or grandparents, you know what that is. But think about being out there on the farmland, elbow to elbow, dehydrated, working all day long, in the rain. You know, it's bad out there. So we talked about being tight-lipped already. Next slide, please. So this one's going to require a lot of clicks. And the first click will tell you about, you know, what we just talked about with personally what happens, and interpersonally, on the next click, we have a lot of different things going on in the farmer. There's lack of time, children still going off the farm, who's going to inherit the farm, a decreased sense of family. And then on an institutional level, we have the fact that what they tell us is that new farmers aren't welcome, and it costs more to get into farming. And you have to change commodities. In Kentucky, we moved from tobacco to hay, and now we're going to hemp. So you have to keep up with the times. There's still no labor. There's not as many farms. You can't get insurance on your crops. Go to the community level. And there, you know, they said it's a dog-eat-dog world. Even if they want to get help for a mental issue, where do you go? There's no mental health resources that are private in these rural communities. So they just feel increasingly isolated. And then we have the encroachment of suburbs, and people don't like what they smell or see or whatever because they're not farm people. It doesn't smell like money to them. And the next one from our society level is increasing regulations, market volatility. A lot of people are going into farming just part-time. So how can you feed the world if you're only part-time? There's still this romantic concept of agriculture that the public has. And let me tell you, there's nothing romantic about being out there. So you can tell from this socioecological model that so many things are going on. You kind of don't know where to go first. So next slide. So let's go back and say, what do we need to do? Well, the first thing we need to do is just what I've said. We need to get ourselves some farm stress literacy. You and I need to know what's happening out there, and so do the farmers. But from our focus groups, we said that we need more people that are trained just to socialize and hang out with farmers. And maybe these are some counselors who do this. Wouldn't that be great? In our community, the Dairy Queen and McDonald's are the local hangouts for the farmers. And if you could just have someone there hanging out with them sort of informally to help them hash through some of these hard conversations about the stress that they're having. And then try to erase that stigma. You know, let's call it what it is. Quit going behind the barn and saying, oh, you know, Farmer Jones committed suicide. I had no idea. Well, let's get an idea. Let's talk about what's happening in the community that maybe Farmer Jones felt led to do this so somebody else won't do it. We're turning to a lot of motivational speaking, and I'm doing a lot of that with farm communities now. It kind of, if we begin to talk about this and we talk about how you get through that stress, it turns the dial down on the temperature of the subject. So people get used to hearing the words and they will start using the words themselves. We're partnering with everybody we know to design and deliver stress messages. The Kentucky Farm Bureau in the June and July issue of their magazine had a whole article just on farm stress and what's going on. So that'll help the non-farm public to learn about this too. So we're trying to take the message to farmers by a variety of people, not just nurses, not just extension people, but veterans, veterinarians, mail carriers, everybody. So we're trying to, I guess, saturate farm communities with some farm stress literacy. So as you've now learned about this, you can find your own resources. One of the things that I suggest to people, if you have a waiting room, you might want to just, if you have a camera rolling up there, just short little burps on, you know, appreciate a farmer or how to combat farm stress. I hate brochures because they get left around, but they are effective. So anything you can do like that will be helpful. Next slide, please. The other thing is, remember we talked about listening and that collective groan went up about how you don't have time. You have to have time, because when you've had a conversation with someone or you've seen them in a clinical practice, pay attention to the last line that they give you as they're getting ready to go out that door, because that's when they might reveal a hint that they may be considering suicide. You know, I don't need to make a return appointment. I won't be here. That's a biggie. Or it's been good. I appreciate you taking care of me. That's all they say. If you're out in the community and the farms appear more run down, something's going on out there, and it might not just be financial. Or if the farmer appears unusually fatigued. And this is one of the things I heard from community members, is the farmers are just so tired anymore, so very tired, more than you've ever seen them. Maybe it's not just the work, and maybe it's not a physical issue they're having. Maybe they're just burdened down with too much stress. And again, of course, a telltale thing is when the animals are not cared for or they're abused out on the farms, we know something is terribly amiss. one of our people said to us, you can tell just by looking that something's not right. And if your gut tells you that, always go with your gut. Next slide, please. And if you hear them in any way saying that they're giving away, especially sentimental objects, there may be, maybe they're just not downsizing. Maybe they're getting ready to not need anything. And if they're unusually happy when they've been down, that may mean they've got a plan and they've settled within themselves that they're going to carry it out. So you must do a mental health assessment every single time you see a farmer. I don't care if you're a dentist, physical therapist, a nurse, a physician, whoever you are, and this can be as easy as saying, so how's life treating you? We do have the mental assessments that I know are standard practice in so many of our institutions now. Farmers do get a little turned off with those. They don't like being asked the Beck depression inventory questions or the CESD questions, but you can at least ease into that conversation by just asking them, so, how's life treating you? You have to start that conversation, though. You can't expect the farmer to do it because the farmer will not do it. So you have to really practice asking them how they feel. And it's a hard conversation sometimes until you get comfortable with that. Remember the first question, if you don't know it's a farmer, are you ever on a farm? And the next question is, how's life treating you? Next slide, please. So for the few minutes that we have left, I'm going to tell you about one intervention that is very out of the box that we're doing in communities now. Basically, we started this in Kentucky and Tennessee as a funded research study through the Centers for Disease Control. And now it's being adopted across the nation and actually even in Ireland. So we're very happy with the success of this. It's called a didactic readers theater. And readers theater is a style of theater in which you don't have to memorize anything. So we get our farmers to actually be our actors. That's a picture of one of our groups. We take 4 farm community people who serve as our actors for this. And we write short scripts, they're about 15 minutes in length, that focuses on the words of the script rather than on the elaborate costumes or sets, although this is a pretty elaborate set that the community got together for this one. And then I, as an ag nurse, have a discussion between each script on what just happened here. And I get the audience to respond to me, and the next thing I know, they're talking to each other and solving each other's problems. Because that discussion allows them to reflect on the content that they just saw and heard, and then they begin to think about this in their own lives or in their neighbor's life. So I guess one of the most poignant parts of one of the scripts, and these are locally based, but we have one in there where the farmer actually has to take his dad's tractor keys away from him, and this is, a horrible thing to do. And so after the script, the people in the audience begin to talk about how they face that in their own family and how they approached it. So it let them know they're not alone in these kinds of instances, and they give each other support and they give each other ideas. So next slide, please. So because this was a research study, we followed up, and we did a 2-week and a 2-month post-theater telephone survey. And we wanted to know not only how did they react to the theater, but did they apply the content in any way. So actually this slide's a little dated. We in the research part, we had 9 sites and we had almost 700 people participate. These theaters are so embraced by the community that we have to limit the attendance to 100 people so we can have a meaningful discussion. And there's usually a wait list to come to the theater, so it's really gone over well. And we actually have a toolkit now that communities can have so that they can have their own theaters without us being in the mix. Next slide, please. So here's what knocked us off our feet. We thought a few people might make changes because we always hear that farmers are stuck in their ways and they aren't going to change, and particularly older farmers. And we started out, these were for farmers age 45 and over, but now they're for anybody. But if you'll look at this, actually, even immediately at the 2-week call, well over half of them had made changes. And we did some further research and found out that about 50% of those changes were substantive changes, not just I'm more careful, but they were making significant health and work behavior changes. And they made even more of them at the 2-month call. And they thought a lot more about making changes because they heard others were making them. It sort of moves the social norm in that community. And even more revealing, we asked if other people they had talked to about what they learned at the theater made changes. And by 2 months, about a third of those people they had talked to had made changes. So it has this diffusion across the entire community. So we're using the theater now. In some, it's totally addressing stress. Before in the research project, it addressed all health and safety issues, some stress. But we are using it now for some groups just as a way to talk about the stress and depression. Next slide, please. So this is now no longer a research project. It's an evidence-based instructional program. And like I said, we're using it across several states. And we actually, it's going to be probably upscaled even more within the next 12 months. So a theater may be coming to a community near you. Next slide, please. Told you about resources, and since you have this PowerPoint, you'll be able to go back and find these, but I will want to tell you there are a couple of organizations on here, AgriSafe being the top one, that third one down. AgriSafe is, it started out being primarily for nurses, but it's for all health professionals, or actually for anyone who serves farm communities now. It's a minimal membership fee, but they have monthly webinars, and those are free and open to the public, so they're 1-hour things, and these are usually research-based presentations, or for programs like I just discussed with you about the theater. So you really want to check out AgriSafe. AgriBility is a program that helps farmers with disabilities across the U.S. It's currently in 23 states, and you can just go to their website and find out if you have that. They also serve farmers with mental disabilities. But if you have a physical disability, you're more likely to have increased stress. So we feel that's a good one. Agri-Wellness is run out of the middle of the nation. It's pretty well operated on a shoestring budget now, but it is for what they call behavioral health, which most of us know as mental health. Also a good one. And then there are some other places, of course, that you can get it. And I'm the ag nurse, so that top one up there is me. I would love to have you join my Facebook page. I don't post often, but when I do, it's usually worth reading, I think. Next slide, please. There's where AgriBility is. And Kentucky's in there, so you can see that we have some good resources here. And the next slide. AgriSafe is the one I talked about. I just wanted to give you on these slides a little more information about each one of those. But the AgriSafe folks are really approachable. If you have something that you think you might want to share about serving farmers in any way, but particularly with their stress, feel free to contact them. And next one. And so there's the Ag Nurse Facebook logo there, and how you can get in touch with me at UK. And just in case you want to know what I look like, that's me down there in the left corner. I showed you one earlier. You know, it was me when I was a kid, but that's how I morphed as years went on. So I hope this has been helpful to you to understand a little bit more about farming in general, the risks that they have, and the stress that they're facing. And my thing for you individually would just be thank a farmer. If we can just get behind them socially right now and support them, they're having an extremely rough 4 years past. And the future doesn't look much brighter economically for them this year. As a matter of fact, it looks a little worse. So just by telling them that you appreciate the hard work they do, when they come into your practice and they say, yes, you know, I'm on a farm, and you find out they farm, just thank them, because that means so much. And that's the first step to a good relationship, where they'll open up and talk to you about issues other than maybe what they came into the office for. So thanks for listening. Reach out to me anytime, and I'll turn this back over.
Great. Thank you, Dr. Reed, for presenting for us. We really look forward to hearing what the students think about it and how they're going to implement these practices in their practices in the future. So thanks you again.
Thank you. Bye now.